All right, guys, welcome back. This is the fourth and final video in my dry needling therapy highlight series that we're doing. This one is going to be the associated risks of dry needling and how to find a good dry needling practitioner. Risks with the dry needling, there's not a ton of substantial risk with it. Generally, you're just going into muscle tissue. The most common side effect, I guess you could call it, is going to be just soreness, right? From basically getting needled. And then the most common visible side effect is going to be sometimes you get bruising, right? You are damaging the skin tissue. Sometimes you can nick a small blood vessel as well. It causes bruising. It doesn't cause any real functional damage. I mean, you can even nick some big artery like the femoral artery if you're needling a hamstring. You'll probably give that patient a pretty big bruise. It's obviously not something that you're looking out to try to do, but there's not going to be any lasting damage from doing that, right? The needles are very, very thin. They're half the thickness of your standard ear piercing, so they're not going to do any substantial damage that way. The biggest real risk associated with dry needling is if you are doing over the lung field. So generally that mid-back area or through the ribs or the chest. There is a very small chance, especially if you're going with a licensed or a certified dry needle therapist, someone who has a specialty in that. There is a very small risk of a pneumothorax, which is basically collapsed lung, where they go in too deep with the needle because they're not paying attention or they hit the wrong spot and they hit the lung field and that causes the lung to collapse. Again, not really a permanent thing, right? But definitely something to, as practitioners, we're definitely trying to avoid doing that. You've never come close to that here in my clinic, but it is one of those things that you should know if you're going to have an educated opinion on whether dry needling is right for you. Now, the other part is, how do you find a good dry needler, someone who knows what they're doing? And that varies a little bit state to state because different states have different regulations on who can and who cannot do dry needling. Like when I was working in Arizona, Arizona requires you to have a separate license and certification through the Board of Chiropractic Examiners to even do dry needling. You have to take a hands-on course. You have to get a certain amount of credit hours by an accredited association, and then you have to apply for percutaneous therapy licensing through the board, right? So there is quite a bit of regulation on who can and cannot do dry needling in Arizona. And you know that if you're going to somebody who does dry needling, generally they are very well trained. In Kansas, where we're practicing now, it is quite a bit different. Kansas has a very strict chiropractic licensing board, but they have almost no oversight on who can do dry needling. As long as you have a medical degree of some sort, whether that's chiropractic, physical therapist, DO, MD, you can perform dry needling with no other formal training, at least right now in 2020, I guess 2025 now. That's kind of how it is. And that is bonkers to me, right? Because as we discussed earlier, there is some risk associated with dry needling, and you want to make sure that you're going to somebody that knows what they're doing. So if you are going to seek out somebody who does dry needling, I would, ask their credentials. Where were they trained? Do they have a certificate? Did they get a formal training, or did they just watch some YouTube videos because there's no oversight in that state and figure out how to do it, right? In Missouri, it's a little bit different as well. Dry needling is under the acupuncture, or under the acupuncture umbrella, so to speak. So if you are a licensed acupuncturist in Missouri, you can also perform dry needling, even though they are very different and distinct practices. They look very similar because they use some similar equipment, but just because you can do acupuncture where the needles only go in a few millimeters doesn't mean that you're going to be an effective dry needler. But in Missouri, they just put it under one umbrella. There's no separate licensing for it. So kind of weird, very state by state. I would always recommend finding somebody that has gotten some formal training in dry needling and has some real hands-on experience doing it.